don't know exactly what happened in this particular case, so we're not going to place judgment, but there was reports of maybe a piece of gauze being in the throat, numerous sedatives in place. So propofol is the same medicine that reportedly caused Michael Jackson's death. When you give someone propofol or any other sedative, anesthetic for that matter, it does one thing, and you're going to look at this animation, which is going to show when you inject these medications into a vein, it's designed to sedate you so you don't have any memory and you don't feel any pain, because that's the whole idea. You don't want to feel your wisdom teeth coming out, but it does another really important thing. It suppresses your rate of breathing. It can slow your heart rate. I call it a cliff. If you give too much and you are not accurately monitoring someone, they can die very quickly. That's why it has to be such a controlled environment. If you're not monitored properly, which is what reportedly happened with Michael Jackson, death can come quickly.
Here's the important point to take away. You don't have to be deeply sedated. You can use a very, very light sedation, which is really safe, you know, Versed with a little cocktail, something like that, where you're not really putting the patient that deep to sleep. But if you really need to knock somebody out, get an anesthesiologist.
Exactly. And Dr. Dorfman, I think the point is not all wisdom teeth are the same, right? Some can be much more complicated, so-called impacted. It depends how many teeth you're trying to do at one setting.
And it's also the patient. I mean, literally, you could probably take out my appendix with me being awake as long as I didn't feel it. I wouldn't care. Where there are other people where you bring a needle to them and they freak out.
And there are reasons, and there are different levels of sedation. You have general anesthesia where someone's completely knocked out. You have to breathe for them. You have conscious sedation. Procedure, for instance, in the emergency department, if you're resetting a bone. Then you have what you're using when you're using nitrous oxide. People are awake.
Absolutely.
It's actually having a good time. You know, when you're on the nitrous
They just feel drunk and they don't care. I mean,
that's why we like going to the dentist.
That's right.
And I do want to just quickly mention that we don't know what happened in this particular case. And the reality is, anytime you were undergoing a sedative procedure, bad things can happen. Luckily, they very, very rarely do, but there is a risk with everything in medicine. So what are some questions people should ask?
The first thing you should always say is, do I really need to be put to sleep? You know, and if you have any medical complications, and that includes being overweight, it's a lot harder to put somebody to sleep when you're bring in an anesthesiologist. That's just a much safer way to go.
So just know what you're getting into. Dr. Dorfman, as always, a pleasure. Thank you.